My first job out of residency was actually at Twin Towers Correctional Facility. And, why would I work in corrections? I think this is one of the most common questions that I've received in my life so far is, why would you work at a jail or a prison? Are you scared? Why would you do that? And that's where I wanted to work. When you have at least 1 in 3 people who are incarcerated are known to have a severe or serious mental illness, that tells us, where patients are actually drifting in the community. And so I wanted to be a part of that, to see how are we caring for those who really are invisible to the outside world. At the state system, at the California Department of Corrections, I was actually at a women's institution. There's 2 all-female institutions among the 33 facilities, and I saw there that there's not just the one patient I had who was accused of postpartum filicide. We had about 20 there, and the news media just didn't see them or forgot about them. And this is an important issue that's not limited to the 1 or 2 cases the media picks up. There is disparate care on the outside. Something is impacting a particular group more. And what are the barriers? What happens? How do we not catch people before they end up incarcerated? I have a community-based practice in general psychiatry and interventional psychiatry, which really focuses on particular populations. We treat many demographics, but in particular peripartum patients, patients with neuropsychiatric diagnoses, including dementia, as well as HIV-positive patients. We need to increase access to psychiatry at the community level. The way that I think is really significant and important fundamentally is to diminish the barriers that keep psychiatrists from taking insurance and Medicare. Basically, enforcing the mental health parity laws. They're not enforced in the state of California. Psychiatry needs to be brought back into where it always has been, which is a medical specialty among other specialties. That's not working when suicide is the 10th leading cause of death right now. It's not working. Those Americans who have any psychiatric diagnosis have, on average, a lifespan that's 7 years lower than everyone else, even when we control for the impact of suicide. 7 years is a lot. So we're really missing a significant population. I actually was a medical student at Tulane in New Orleans during Katrina. I'm often asked about that experience and how difficult and to go through that and to see the destruction of New Orleans. It was a very difficult experience. I learned a lesson during that from someone that has impacted what I do and probably will for a very long time. The deans communicated with us within about a week and said, you all need to be at Baylor School of Medicine 3 weeks, and you'll be able to graduate on time if you get there. And he explained that an alumni of Tulane, Dr. DeBakey, was paying for the administrative transfer of all 600 medical students to Baylor in that time frame so that we would not lose our opportunity to graduate and match, etc. And on our first day in Houston, he actually met us and welcomed us. And his generosity and also just ability to be decisive, support this group in a way that we desperately needed, allowed us to graduate on time. I often think about that and think about him in terms of everything he accomplished in his life. What people maybe do not know about him is that he also gave 600 medical students the opportunity to advance in a timely manner and go out into the community and provide care. I've taken a lot from that we as a group really do need to support each other and need to work together to be the most effective in delivering care.